Hello, I'm Dr. Frances Pitsillis. How can you stay safe when you're having a dermal filler treatment? Yes, they have been in the news and the problems that can occur with dermal filler treatments. Well, the common problems that we don't worry about too much are swelling or a bit of bruising, and this has all been reduced by the use of cannulas a lot more than we all used to do. In addition to that, you have the risks of lumps and bumps. These lumps and bumps can be red, swollen and painful, or they can be non-painful and not swollen, and we know how to treat all of those. But the important thing in relation to them is to avoid going to the dentist 4 weeks either side of having your treatment, even if it's a teeth whitening treatment, because having any treatments like this cause the release of bacteria from your gums that can circulate and attach onto the product and then cause these lumps or bumps. Now, the other thing that's very important is the use of very good sterile conditions when you're having your treatment, which means that it's important for you to have that in a professional medical environment. But probably the most concerning potential side effect of dermal filler treatment is the risk of blindness. Yes, blindness. In studies from overseas, they found that 48% of those who went blind had injections of fat actually in the area between the brow. And we do know that there are 2 blood vessels here that can be inadvertently injected, and then they connect with the circulation that goes to the back of the eye. Now, also, 33% of people who went blind from dermal fillers had their noses injected. There is a rich blood supply around the nose and around the sides, and these blood vessels also can connect with the blood vessels that go directly behind the eye, and then it can threaten the circulation of your eye. So why is this happening, and why is this a risk? Because it's pure anatomy. The facial artery gives off arteries all through the face to supply the lips, the nose, the cheeks, and arteries of the facial arteries can connect to other arteries around the eye and around the nose that then supplies the back of the eye. So it's a pure anatomical issue, and one of the most important things is that we don't inject these areas in our clinic, and that we know our anatomy very well. In addition, we have special techniques and equipment that helps us assess the anatomy before we treat each patient with dermal fillers, and we go very carefully with it so that we don't have any of these problems. And in fact, luckily, we haven't had any of these problems in our clinic.